News, authoritarian measures and senseless regulations, the fallout from the global pandemic. Now, how do you ever roll back these measures and abuse of science to keep people safe? Well, as the world continues to try to find a cure for COVID-19, top scientists have come together to form a scientific advisory board. Pandemics Data and Analytics has launched the board, this to reinforce credentials and mission to provide independent, accurate and scientific analysis. But for more on the significance of this board, we speak to the organization's coordinator, Nick Hudson. Nick, a very warm good morning to you. Thank you so much for coming back, of course, right here on the show. And then I want to start with that particular question on the significance of this board. Why did you see a need for this?
One of the problems with this whole situation and its intensity is that many academics are actually afraid to speak out. So a lot of the people who were involved in the science, who have been helping our organization, have been unwilling to put their names on our website or to be identified in public as being part of our organization. So it's a very important step that these massive leading lights in epidemiology, virology, infectious diseases have come onto our board and been willing to step forward and be identified with us.
But why are they afraid to speak out, Nick?
Well, there's been an incredible trend over recent years towards what I think is aptly described as cancel culture. If you speak out against a prevailing narrative, and a very strong one that we have with coronavirus, you take a big risk. Your livelihood can be under threat. We've had people who were part of our organization who've been badgered out simply by pressure from their institutions or their social groups, and for doing nothing but speaking the truth.
That's interesting that you mentioned this cancel culture, but also on the other hand, you feel that as an organization there's a need, for more of a reputable, high quality, thorough analysis that needs to be conducted, as well as transparency, I suppose.
100%. This whole reaction or overreaction to coronavirus has been plagued with scientific nonsense from the start. I mean, the very concept of lockdowns has no precedence in the literature. You know, the World Health Organization, the CDC, any number of epidemiological journals have for decades ruled out lockdown as a strategy. And suddenly we have them.
And how much then of fake news or misinformation has already been disseminated according to your analysis?
Massive fake news. I mean, even from the scientists in government, we keep on hearing about the deadly second wave, and there couldn't be anything further from the truth. The second waves that you've been seeing in Europe in particular, for example, have simply been explosions in cases. They've not had any accompanying deaths. And yet the scientists tell our politicians that there are deadly second waves, and it simply isn't true.
But Nick, that is quite concerning, right? Because if the government is the first responder to the public when it comes to how to not only prevent, oneself from contracting COVID, but also what measures to take. And on the other hand, you're sharing with us this morning that there might have been some misinformation. Where then does the public go to get this information? Because the government will continuously say that they have expert advice, hence they can back up their support of whatever information they're disseminating.
Well, I think increasingly, Tumelo, what people are starting to realize is that there is something wrong, that the world isn't quite as it was made out to be. They've been told to live in fear. They've been told that there's a deadly virus to which everybody's susceptible. We're all going to die. And I think people one by one are starting to realize that they've been led by the nose. So there are places they can go. They can start with our website. They can start by reading what the members of our advisory board have to say and their suggestions as to what the response to the coronavirus epidemic should in fact be.
And perhaps please share some of that, that response rate as to which Panda is targeting when it comes to the virus, and what some of those opinions we can find on the website.
Well, we've said from the very beginning that one of the most obvious features of this disease, coronavirus, is that the young and generally healthy people are really not at risk here. Their risk is negligible. It's much lower risk, for example, than they would normally face with a seasonal flu. And so it never made sense to us that you would have a general lockdown and lock down the whole society. We called from the start for targeted measures to protect the vulnerable, which is a minority of the population, and to allow everybody else to go about living their lives so that we can generate the wealth and incomes that pay for our healthcare services and get to herd immunity as quickly as possible, so that the old people and vulnerable people are exposed for a shorter period of time. And we've done exactly the opposite. We've gone through these very costly general lockdowns which have destroyed our economy, diminishing our capacity to take care of anybody in respect of any risk. And we think that that's a great tragedy. We've been saying this since May. The scientists who are on our advisory board say exactly the same thing, and they're backed by the very best in modeling and academic theory. So there you have it.